NHA CCMA practice questions. Question 1. A medical assistant is checking the liquid controls for a CLIA waived gluconate device. How often should these quality control checks be performed according to manufacturer standards? Option A. Once every month. Option B. On days when patient tests are performed. Option C. Only when a new medical assistant is hired. Option D. Every time a new patient is brought in. The correct answer is option B. On days when patient tests are performed. Quality control for CLIA waived point-of-care devices must be run on each day that patient testing is performed, per manufacturer instructions and CLIA guidelines. This ensures the device is functioning accurately before any patient results are reported. Question 2. Which tube should be collected first if a provider orders a blood culture, a prothrombin time, patient, and an electrolyte panel? Option A, light blue top tube. Option B, yellow top blood culture tube. Option C, green top tube. Option D, red top tube. The correct answer is option B. Yellow top blood culture tube. Per CLSI order of draw, blood culture bottles, yellow top, are collected first to avoid additive contamination and to minimize skin organism contamination before other tubes. Blood cultures are followed by light blue coagulation tubes, then other additives. Question 3. When performing a capillary puncture on an adult patient, which site is choice for the procedure? Option A. The lateral aspect of the heel. Option B. The distal pad of the middle or ring finger. Option C. The tip of the index finger. Option D. The fleshy lobe of the ear. The correct answer is option B. The distal pad of the middle or ring finger. The lateral or medial pads of the middle or ring finger are the standard sites for adult capillary puncture because they have adequate tissue depth and good capillary blood flow. The fingertip is avoided due to greater nerve density and pain. The heel is reserved for neonates. Question 4. A medical assistant is administering an intradermal injection for allergy testing. At what angle should the needle be inserted? Option A, 10 to 15 degrees. Option B, 25 to 30 degrees. Option C, 45 degrees. Option D, 90 degrees. The correct answer is option A. 10 to 15 degrees. Intradermal injections are administered at a 10 to 15 degree angle, nearly parallel to the skin, to deliver medication into the dermis. A properly placed intradermal injection produces a visible wheal or bleb under the skin. The 90 degree angle is used for intramuscular injections. Question 5. A medical assistant is reviewing a list of community resources for a patient who is experiencing food insecurity. Which program would be most beneficial? Option A, WIC or SNAP benefits. Option B, workers' compensation. Option C, Medicare Part A. Option D, hospice care assistance. The correct answer is option A. WIC or SNAP benefits. WIC, Women, Infants, and Children, and SNAP, Supplemental Nutrition Assistance Program, are federal nutrition assistance programs specifically designed to address food insecurity. Workers' compensation covers workplace injuries, and Medicare Part A covers hospital services. Question 6. A medical assistant is preparing to measure a patient's blood pressure manually. How high should the cuff be inflated above the point where the radial pulse disappears? Option A, 10 mm Hg. Option B, 30 mm Hg. Option C, 50 mm Hg. Option D, 60 mm Hg. The correct answer is option B. 30 mm Hg. Standard technique requires inflating the cuff 30 mm Hg above the point where the radial pulse disappears to ensure complete arterial occlusion. This allows the auscultatory method to accurately capture both systolic and diastolic readings. Question 7. In preparation for a sigmoidoscopy exam, the patient should be assisted into which of the following positions? Option A, lithotomy position. Option B, Trendelenburg position. Option C, Sims, left lateral, position. Option D, prone position. The correct answer is option C, Sims, left lateral, position. Sims position, with the patient lying on the left side with the right knee drawn up, provides optimal access for sigmoidoscopy and rectal examinations. Lithotomy is used for pelvic examinations, and Trendelenburg is used to manage hypotension or facilitate abdominal surgery. Question 8. When collecting a sputum specimen for culture, when is the best time to instruct the patient to collect the sample? Option A, immediately before going to bed. Option B, right after eating a heavy lunch. Option C, first thing in the morning before eating or drinking. Option D, mid-afternoon following an exercise routine. The correct answer is option C, first thing in the morning before eating or drinking. Sputum is best collected upon awakening in the morning before eating, drinking, or oral hygiene, as respiratory secretions pool in the lower airways overnight. This yields the highest concentration of organisms and the most clinically representative specimen. Question 9. A patient requires an intramuscular injection of a thick, oily medication. Which needle gauge is most appropriate for this administration? Option A, 18G. Option B, 21G. Option C, 25G. Option D, 27G. The correct answer is option A, 18G. An 18-gauge needle is appropriate for viscous or oily medications because the larger bore allows the thick fluid to flow without excessive resistance or prolonged injection time. Smaller gauges such as 25G or 27G are used for subcutaneous injections and thin solutions. Question 10. When communicating clinical details about a patient's condition to another healthcare provider, which structured framework is commonly used? Option A, SPAR, situation, background, assessment, recommendation. Option B, HIPAA guidelines. Option C, SOAP notes formatting. Option D, OSHA safety data sheets. The correct answer is option A, SPAR, situation, background, assessment, recommendation. SPAR is a standardized communication tool used in handoffs and clinical consultations to ensure all essential information is conveyed efficiently and in a logical order. It reduces communication errors and is widely used across healthcare settings, including during transfers and urgent calls. Question 11. Which document provides instructions regarding a patient's preferences for medical treatments, such as mechanical ventilation or tube feeding, if they become incapacitated? Option A, healthcare proxy. Option B, informed consent form. Option C, living will. Option D, durable power of attorney for finances. The correct answer is option C, living will. A living will is a legal advance directive that specifies a patient's wishes for life-sustaining treatments should they become unable to communicate. A healthcare proxy designates a person to make decisions, while a durable power of attorney for finances covers financial matters only. Question 12. A 6-month-old infant is brought to the clinic for a well-child checkup. How should the medical assistant measure the infant's length? Option A, hold the infant upright against a wall-mounted tape measure. Option B, place the infant supine on a measuring board and extend the legs fully. Option C, wrap a flexible tape measure around the infant's torso and limbs. Option D, mark the paper on the exam table at the crown and heel while the infant is prone. The correct answer is option B, place the infant supine on a measuring board and extend the legs fully. Infants under 2 years are measured in the recumbent, supine, position using an infant measuring board to ensure full extension of the legs. Standing height is measured only once the child can stand steadily, typically after age 2. Question 13. A clinic utilizes a scheduling system where 3 patients are scheduled at the top of each hour and seen in the order of their arrival. What type of scheduling is this? Option A, wave scheduling. Option B, modified wave scheduling. Option C, cluster scheduling. Option D, double booking scheduling. The correct answer is option A. Wave scheduling. Wave scheduling books multiple patients at the beginning of each hour and sees them in order of arrival, smoothing out provider downtime by allowing some flexibility for varying visit lengths. Modified wave scheduling staggers these appointments slightly to reduce waiting room congestion. Question 14. According to current American Heart Association guidelines, which of the following blood pressure readings is classified as elevated? Option A, 118/76 mmHg. Option B, 124/78 mmHg. Option C, 132/84 mmHg. Option D, 142/92 mmHg. The correct answer is option B, 124/78 mmHg. AHA guidelines define elevated blood pressure as a systolic of 120 to 129 mm Hg with a diastolic less than 80 mm Hg. Normal is below 120/80. Stage 1 hypertension begins at 130/80, making 132/84 stage 1. Question 15. Which of the following fasting blood glucose results falls within an abnormal, pre-diabetic range for a non-diabetic adult patient? Option A, 65 mg/dl. Option B, 85 mg/dl. Option C, 115 mg/dl. Option D, 145 mg/dl. The correct answer is option C, 115 mg/dl. ADA criteria define pre-diabetes, impaired fasting glucose, as a fasting blood glucose of 100 to 125 mg/dl. Normal fasting glucose is below 100 mg/dl. A result of 126 mg/dl or higher on two separate occasions meets the diagnostic threshold for diabetes mellitus. Question 16. A medical assistant accidentally sustains a needle stick injury with a contaminated needle. What is the very first action that should be taken? Option A, notify the clinic manager or supervisor. Option B, wash the exposed area thoroughly with soap and water. Option C, report to the nearest emergency department. Option D, complete an incident or exposure report form. The correct answer is option B. Wash the exposed area thoroughly with soap and water. Immediate and thorough washing of the wound with soap and water is the first priority to reduce pathogen load at the exposure site. Reporting and post-exposure prophylaxis follow after initial wound care. Delaying washing to report first increases infection risk. Question 17. A patient has been diagnosed with a reportable communicable disease, such as tuberculosis. To which agency is the medical office legally required to report this information? Option A, the Centers for Medicare and Medicaid Services, CMS. Option B, the local or state public health department. Option C, the Occupational Safety and Health Administration, OSHA. Option D, the Joint Commission. The correct answer is option B, the local or state public health department. Reportable communicable diseases must be reported to the local or state public health department as required by state law and CDC guidelines. This reporting enables disease surveillance, outbreak investigation, and contact tracing to protect public health. Question 18. When attaching EKG limb leads, which color electrode is traditionally designated for the right leg, RL, and serves as the ground? Option A, red. Option B, black. Option C, green. Option D, white. The correct answer is option C, green. In the AHA color coding system, the right leg electrode is green and serves as the electrical ground to reduce artifact. The mnemonic "Ride your green bike," right arm equals red, left arm equals yellow or black, green equals right leg, helps with lead placement recall. Question 19. Which legal doctrine states that an employer or physician is liable for the negligent actions of their employees performing duties within their scope of work? Option A. Residential ipsa loquitur. Option B. Subpoena duces tecum. Option C. Respondeat superior. Option D. Quid pro quo. The correct answer is option C. Respondeat superior. Respondeat superior, Latin for let the master answer, holds employers legally responsible for torts committed by employees acting within the scope of their employment. This doctrine reinforces the importance of proper training, supervision, and defined scope of practice. Question 20. A medical assistant is performing a rapid strep test on a patient. Which areas of the throat should be swabbed? Option A. The tongue and the hard palate. Option B. The peritonsillar areas and the posterior pharynx. Option C. The buccal mucosa and uvula. Option D. The lower gums and the anterior teeth. The correct answer is option B. The peritonsillar areas and the posterior pharynx. The peritonsillar area and posterior pharyngeal wall are the sites where group A streptococcus colonizes and should be firmly swabbed to collect an adequate sample. Avoiding the tongue and uvula prevents gagging and contamination of the specimen.